Your aorta is a heavy hitter, the largest artery in your body. It's responsible for carrying blood from your heart to other organs.
In order to maintain structural integrity of the aorta, there has to be a certain amount of wall tension. You can think of a balloon. As a balloon expands with air, the wall itself is under increasing tension. Over a certain size, just as a balloon becomes prone to pop, the aorta has a tendency to become weaker. Eventually, if it goes untreated long enough, it can rupture.
Which is why you can get what's called a AAA screening. That stands for abdominal aortic aneurysm. Getting this ultrasound screening can be a life-saving exam if you're at high risk.
Men between the ages of 65 and 75 who have a history of smoking, but will commonly extend those criteria to include women and also any patient with a family history of AAA or other specific vascular risk factors.
The ultrasound images help your radiologist look at the size of your aorta. 3 centimeters or more wide could signal an aneurysm.
And so depending on the initial diameter of the aneurysm, the radiologist and the referring clinician will collaborate to come up with a surveillance program. However, when a patient is showing signs of rupture or a very large or rapidly growing aneurysm, some of the options would include treatment by a vascular surgeon, which is a routine but serious operation. In some instances, a catheter is placed into a peripheral artery and a stent is placed actually into the aorta itself to stop it from enlarging.
If your aorta is somewhat enlarged, you may be able to treat it by making lifestyle changes. Your AAA screening won't take long, and it will give you and your doctor answers.
The actual scan itself is relatively fast.
Take a deep breath in and hold your breath in.
There's no IV required. There's no needle sticks. The probe that's placed on the abdomen is made of plastic.
An easy trade-off for the peace of mind when it comes to your health.